Today, at last, we have seen they've published the white paper on the universal health. Now, it's a discussion paper for 8 weeks.
A discussion paper, Eileen, for 8 weeks is an insult to the people of this country. Absolutely. This day, 8 weeks, the 20th of May, over the period of local and European parliamentary elections throughout the length and breadth of the constituencies in this jurisdiction. And yet, this is what James Reilly is offering in terms of a consultation period. It doesn't in any way equate with that, and it's an absolute insult, as I've said. We have to recognise that this is a fundamentally flawed document. Indeed, the very kernel of Fine Gael's approach to this, and I do make the point, Fine Gael's approach to this is indeed to provide for private, for-profit competing health insurance companies to be at the centre of the provision of health services into the future, and that is tantamount to privatising our existing public health service. It's not acceptable under any circumstances. It will be very interesting indeed to see where the Labour Party stand on this. This document fails on so many levels. It offers no costings. Where, for instance, will the people currently without a medical card and who have not got private health insurance be with the introduction of this scheme? What will it cost them? Because that's the critical question that they're asking. They're already living on the margins. And what is it going to cost them? What indeed, in relation to the so-called consultation process regarding the basket of services that will come under the introduction of this UHI? What conditions, what syndromes, what needs will not be provided for in terms of this basket of provision that James Reilly is speaking about? This document is not only coming very late, it's half-baked, and it's based on a fundamentally flawed approach. We in Sinn Féin are absolutely committed and support the introduction of universal healthcare delivery right across the board, but based on fair and progressive and general taxation. That is the way to pay for it, not by this further means of further burdening people who are already struggling to make ends meet and who are paying through their taxation, through one form of taxation or another, because there is nobody living in this island who isn't a tax contributor, either from their income stream or as a consumer. We are all providing to the Exchequer in one way or another, and that is the basis by which our healthcare, our public healthcare system, must be provided for into the future.